Okay, so let's get started. Bismillahirrahmanirrahim. So we are again today, again, and tomorrow we'll be doing the same thing, putting it all together, applying Mosque Peak or Toolkit to impact health disparities through community asset mapping. So, in today's session, we will, inshallah, go through we're doing more didactical work in these three sessions. So, exactly where the rubber meets the road. And when we actually talk about being on the ground, at the grassroots level, we have deployed a couple additional techniques and we borrowed that from the project management. So inshallah, we will continue to borrow some of these best practices of the management industry and some of the proven methodologies for that they use um, in the um, let me see. I'm sharing. I just want to double check a couple things. I'm sharing. I'm muted, and everybody's seeing my slides.
Mhm.
Was everybody seeing my
No,
slides?
not yet.
No.
Not yet.
Okay.
No,
Mhm.
I can't see the slide.
I thought so.
Mhm.
Okay, just remembered. Okay, now we are. Perfect. Um, so just going over the topics for today. And as I said, that we are borrowing from the best practices, from the management methodologies. So we want to use what works out there. And for sure, the rest of the information technology, for profit, marketing industry, sports industry, you name it, other than any industry other than healthcare, have got it right. So we've got to borrow some of the techniques from them, borrow it on the healthcare side so that we can be as successful as any other folks are when they market their products. So with that, we are going to make, inshallah, the dua. Um, and I would ask Abdurrahman to recite this dua for us, inshallah.
Assalamu alaikum everyone. So I'm just gonna start off with a very short dua. Bismillahirrahmanirrahim. ربنا هب لنا من أزواجنا وذرياتنا قرة أعين واجعلنا للمتقين إماما. And the translation goes, O our Lord, bestow upon us from our spouses and our offspring the comfort and coolness of our eyes, and make us leaders of the muttaqin, the pious. Amin.
Amin. Amin. Summa Amin. So with that, we would like to start with a little knowledge check today. I plan on being done in the next 40 to 45 minutes. So we would want to hear from uh, Sister Beverly here. And I want to know more about what she does and how she does it. So, with any further do's, I would like you guys to answer in the chat box. I have here seven items or seven phases or processes, you can call it. Some of them are project management, some of them are PCOR. So I've number one, in the first question, I want you to list out of these, list three phases of PCORI project lifecycle. In the question number two, I want you to list the five project management processes. So I'm going to open the chat box. Oh, I can't see the chat box. I got to have that this thing on. Okay, so let me know when you guys are done. Or Masood, can you let me know if everybody has answered? You can just type question one, A, B, C, D, whatever you think is, and question two, A, B, C, D, whatever that is.
EGF.
Sister Fatma, would you like them to answer both the questions right now and then do it, or you want to do one by one?
Well, you can write down question 1, whatever your choices are, and question 2, whatever your choices are.
I think everybody has answered both the questions.
Okay. Let's see. Let me take a quick look. Okay. Nice. Okay. So you're right. So the PCOR project lifecycle has 3 phases: plan, conduct, and disseminate. And the project management processes are initiate, plan, execute, monitor and control, and close. So planning basically duplicates in both the project management and PCOR. They say that and I'm sure you guys have heard it too. Not planning is basically planning to fail. So planning is pretty important, and I just want to um, uh, re- revisit the 2 overlapping cycles. You have plan, conduct, disseminate, and you have project management. And so we talked about the project charter yesterday, and we also talked about the project plan. And the project plan in PCOR terms actually overlaps the plan and conduct phases. So this is how PCOR runs it. And so there are various specific activities that belong to each one of the project management process, and that is why project management is it actually has detailed out the various steps that you can actually do in the action items. So therefore, if you are given a recipe, it is more than likely you're going to make something out of it. Rather than when you don't have a recipe. So really project management works as a recipe. And with the patient-centered, with PCOR, PCOR actually is more like a garnish and more like a relish and the dressing on it, because PCOR adds flavor, and that's really, it works as bringing the entire thing together. So I love using both together side by side. So I just want to revisit again project charter. We went through it yesterday. Project plan. The project plan happens to be relatively a bigger document. And as you move forward, there are several different plans that actually becomes a part of project plans. And we will see in a minute how it goes. It is a combination of many different plans, like time management plan, scope management plan, risk management plan, communications management plan, stakeholder management plan. So all the 13 knowledge areas that we said, each of the plan goes in it. So anyways, the project activities, that is a part of the execution phase. And we know what the project activities are from the proposal. So it is very well defined in the grant proposal. In fact, a lot more defined than what you have in the project management. So again, blending the two methodologies really brings a lot of benefit to us. And the lessons learned. Lessons learned is a really neat feature in project management. They actually don't measure as much as outcomes. However, they do say what went right and what went wrong. And that is something which I have actually kind of missed out on partially, not completely. In the research projects, we do take care of what exactly did not work, and we do some in the conclusions and the discussions of any research paper. You do see that a little bit to the extent, but not to the detailed extent that that account is accounted in the project management methodology. So again, both running together, lends a lot of power to the actual technology, to the actual project. So as I mentioned, that project plan is made up of several knowledge areas. We talked about 10 knowledge areas yesterday. So if you look at this whole grid, this one piece of paper in the background that you see, this is like a recipe for project management. And if you have this one, I usually keep one on my wall and I refer to it every so often because it tells me exactly what to do. And if you I'll actually share the actual scan it and share it with you guys in the project documents of our shared folder. It is a very interesting document if you don't know exactly how to do it, but you would at least know what to do it. So there is a project in the project planning phase. You actually develop 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. You actually developed 10 different plans. However, for our part of the project, this is mainly an engagement project. So we can tailor to this methodology to whatever our needs are. And in every project, you actually take the entire thing and you tailor it for what you need and what you don't need. So overall, we are going to be making the overall project plan. The scope plan actually right here that's the proposal itself. The time schedule or time management actually goes with the timeline that we already have. The cost management plan is coming into play because of COVID. So I am going to be redoing the cost a little bit. So therefore, and PCORI would also my proposal is going to be adjusted on that as well. Not that the total dollar amount is adjusted, but how we use the funds, that gets adjusted. Evaluation metrics. This is actually the quality management plan. So in the regular projects, you can have the different kinds of quality as to whether that met the stakeholder satisfaction criteria or not. The investor criteria in our project, it's basically the outcome measures or the evaluations that we are going to put out. And that actually becomes a part of the dissemination plan in PCORI's language. So you're going to see that hopefully either not tomorrow, but on Saturday. We would mention it and exactly how we would be reporting on that. What does dissemination account for? So we would hear about on that. And the communication plans, that plan is a must with stakeholder engagement. And we will go over a little bit of details about the communications management plan today. And then you have the part of the stakeholder plan. So not the part of, you have the stakeholder plan. And then we would go over that today. What are the components of it and how we would put it together? I don't have the plan ready yet, but I have all the components ready that needs to go in the stakeholder plan. So I will share with you all of these components, because when we talk about a stakeholder engagement, all of us are doing this together. It's not that I am responsible or you're responsible or who he or she. It's all of us are in this together, and we're going to be taking care of the stakeholders, because the entire community is a stakeholder. We are part of stakeholders in it. So it's all of us. Basically, and how do we keep ourselves engaged, and how do we engage the other people? The project procurement plan, that's really not needed. And then, I'm sorry, the project risk management, that is the part of the stakeholder plan. And then we have the stakeholder plan. So the risk management is, there are risks associated with the stakeholders as well. So I will give you that. That's something which I didn't find in Picori. I'm sure there's got to be a way that they have it in there, or they may have been borrowing it from the project management methodology as well. But when you are running a community-based project, every stakeholder brings with them a positive and negative risks. So how do you manage that? And in project management, there is a very set technique to actually do it. It makes things very easy and makes things much more transparent to work with. So inshallah, we're going to review those techniques today as well. Okay, so let's move on to the project management model for stakeholders. So with project management, you have 4 things that you're going to do with the stakeholders. Number 1, you're going to identify them, exactly who your stakeholders are, whether they are internal or external, what categories they are, whether you have accounted for every one of them, or are you forgetting about somebody, the known knowns or the known unknowns, and we all can help each other out in identification of the stakeholders. I actually have a Excel sheet in the community, in the EMPart CHW folder that I shared with everybody. And by the way, every one of you has the editing privileges on that drive. So be very careful when you are changing something, because you are modifying it, and that's the only place we have. The reason why we are working with that is, number 1, this is actually a project that you would probably see in a corporate world, where you are running it pretty rigorously, and there is a central place where everybody very responsibly interacts, and they keep track of what was there and how they are changing it. So it would be a nice experience for everybody to actually work collaboratively in the team. And these are some of the perks that that basically, when you work with Worry Free Community, it comes in as a package, guys. So we run things, we take community work very seriously. This is not a part-time organization. We do it, we run it like we are running a corporate project. I come from a corporate world. I came from corporate healthcare to community-based nonprofit. And I don't understand why we don't do things the way we do it in the corporate world. Why should it be any different? This is indeed healthcare after all. So I like to see things professionally, and inshallah, we want to keep it that way. So you're gonna see that. So I have a grid out there for the stakeholders. You're gonna see a stakeholder priorities. There's a stakeholder grid. There are risk factors in there. You would also see the details about the stakeholders. Because we are sharing all of this within a community, you are part of this community as well. And so as part of the project, you would be seeing and looking at things and probably modifying it and changing it and if you are not sure of something, you can probably put it in a comment box, suggest it, so we can have a consensus, or we would have a second opinion and come back and finalize the decision. So this is part of basically doing the teamwork. Once we identify them, there are 3 steps for a stakeholder engagement according to the project management. There is planning, there is managing, and then there is monitoring. So these are the 3 specific elements in project management model for stakeholders, by which you keep the stakeholders not only engaged, but also satisfied. Now, our goal is not really stakeholder satisfaction in this project. I'll reiterate that. Our goal is not stakeholder satisfaction in this project, but it is stakeholder engagement. Not necessarily that one is better than the other. It's just that these are totally 2 different things. When you're talking about a stakeholder satisfaction, the stakeholder is the one that is giving you the criteria for satisfaction. Now, in this case, we are actually we are actually engaging the stakeholders. And the reason why we are engaging them is basically for patient centeredness. So, in one sense, the stakeholder does have a satisfaction. A satisfaction level with us. If they are not satisfied, they're going to wean themselves all off and they will be disengaged. But when you keep them engaged, that is a good sign that they're also satisfied. Well, but satisfaction also have that element of positivity and of agreeability. They may not agree with us, but they would want to see how far are we going, because it's a process of co-learning. So we may not learn everything right away from them, and it's a slower it's a spectrum, and the more we exchange, the more we learn about each other. So that is why don't expect satisfaction to come right away, and don't try to meet that. Our goal is to find out what's best, what works in the community, and what works for that particular patient. So engagement has three components: plan, manage, and monitor. Okay. So now you have a lot of the different, a lot of the different stakeholders in Picori's terms. You got healthcare providers, you got policymakers, you got payers, you have faith-based communities, you have researcher and institutions, you got patients and caregivers, and you got law enforcement officers, you got parks and, the nature as well. So now you are here in the middle and you're thinking, who are my stakeholders for this particular project? Now, what is the project that we have in sight right now, right? So asset mapping is really an engagement strategy, as well as it gives us a taste of project management and running a project in the community. So in our case, basically, you are identifying with those folks in the mosque community that may be coming with an asset, or they require an asset, and those folks become your stakeholders. Sometimes, this is sometimes these are basically the stakeholders that is residing within your mosque community, and sometimes they are going to be outside your mosque community, because and there is also going to be a criterion which we all will decide together as to what are the assets that we want to have and what are the assets that we don't want to have. We talked about culturally sensitive assets yesterday and a little while ago as well. So if we look at going back to our favorite graphics here, this, again, thanks, Dr. Rebecca. This is such a beautiful figure. I can't, this itself is a phenomenon, by the way. Yeah, I love it. So primarily, we're going to look at this and we say that, look here, we're looking at health factors, and we have the different assets that actually map to the different subcategories here, right? So we talked about this yesterday, and now we are going to bring in the providers, which is some of them are going to be clinicians, researchers, purchasers, payers, industries, hospital, and then we would actually map them to each one of them. We can also map them to the health factors, such as health behaviors. For example, clinicians actually are part of quality of care, and they directly impact clinical care. That contributes 20% to our well-being, right? You got policymakers, and policymakers really come in with health behaviors. They also come in with physical and environmental. They also come in with social economic factors. So all of these folks also have impact us in different ways. Training institutions, payers, purchasers. So for example, a purchaser of, let's say, an alcohol company, actually that ties in with the health behavior, because they are, in a sense, affecting our lifestyle, our healthy behavior. So therefore, that contributes 30% to our wellness. So we all of the different for example, you have a food pantry that actually is a provider with us, and that's a purchaser, and that's also an industry. So the food pantry ties in with social and economic factors, and therefore you are going to tie the food pantry with family and social support, and you are going to tie them, or you can also tie them with income, and therefore food pantries contribute or directly are linked with the health factors, which contributes 40% to our well-being. See how this is all coming together, and how the assets that we see are impacting, and how our social engine that is sitting right in the middle is helping not only the stakeholders, not only the asset owners, not only the patients, but the entire community. And really, in a sense, it would end up impacting health disparity, because that's essentially we want to calculate. We are doing all of this work, and we want to know whether all of this work really did impact a health disparity or not. And by what kinds of health disparity did it impact? And what were the means of the health factors, or which health factors did it really impact it through? So this is literally, by themselves, it's a publication in itself. So it's going to be pretty interesting. So going back to identification of your providers and your assets now. That's what we would be doing. Keep in mind, you also have patients, you also have caregivers, you have caregiver companies that will be a part of your stakeholders as well. So you have in stakeholder identification, the project management methodology actually gives us, by the way, this little guy with the wheels turning, that's actually a project manager. The wheels keep turning all the time. So wherever you see this particular figure, which means that I'm borrowing something from project management documents there. So it regularly keeps, there are 3 steps in stakeholder identification. So basically, if you do those 3 steps, you're done with the stakeholder identification. That's what they talk about. So again, it's a recipe. One of the things about stakeholder identification is that you have to regularly identifying stakeholders throughout your project. So for as long as this project lasts, which we would actually stop the data collection sometime at the end of February or in March, early March. That's when we will stop the data collection. Until then, you would keep identifying any new person that presents themselves as a stakeholder that pertains to any of the stakeholder categories in PCORI terms becomes a stakeholder to the project. And therefore, that person needs to be registered in the stakeholder register. So we're going to look at the stakeholder register as well. If not, then we'll look at all of the documents together on Saturday, inshallah. It is, by the way, it is on there on the CHW drive. Step number 2 is analyze and document relevant information on their interest, involvement, interdependencies, influence, and potential impact on the project success. So, for example, you found out that there is a particular a stakeholder that is actually that is pretty influential, and but they are not local, they may or may not have an impact on or they have a lot of assets that they are linked with, and if you put them on the project success would actually be amplified. So now you are looking at it that, yes, is that number 1, you have to identify if that person is a stakeholder or not. If they have local assets and they are mapped to the local assets, which means that they do carry the influence, and they would benefit from your project and you would benefit from their involvement. So therefore, that itself is a criteria to get the stakeholders on board, so that in a sense, the community would benefit at the end, because you're bringing one person on board and they are bringing in this entire community assets, which would help many of your other stakeholders in return. So that potential impact would lead to the amplification of the project success. So you definitely want to design a strategy. You want to have appropriate focus on each of that stakeholder to know what kind of attention you need to give to one stakeholder versus the other stakeholders. To some, you want to give more attention to others. You want to give different kinds of attention. Not every one of us really we are in tune with who is intersecting with us at any given point in time, and the impact that that particular person or personality has on our work for the long term. And a lot of the time, and I do see, and again, this is kind of a strategy that some people are born with, some people learn it, and some people have to adopt it. So I'm not sure which category you fall into. I actually happen to be one of those people who really learned it, and I had to force myself to learn the techniques and the engagement strategies, and making sure that I can keep people engaged over the period of time. And not only that, but also even after the project is done and once we have departed, how would you keep intact the relationship, so when your paths cross again, you pick up where you have left off. So these are some of the very important strategies in life as well, and they go hand in hand well with our project coordinations. Internal versus external stakeholders. PCORI does not differentiate between internal versus external, but definitely internal stakeholders have a lot of leeway and a lot of influence on the project outcomes versus the external stakeholders. But project management does differentiate. But here is a map that actually this particular map that you see, imam, board members, community health workers. Masood actually came up with this, and because he does a lot of outreach in the community, and he says this is where he sees himself right in the middle. And he has this powerful technique where he actually engages the program committee leads. So that, for example, the mosque may have nutrition program, and there are a couple people who are involved in the nutrition program, but one person is leading it. So you want to know who that lead is. That lead is yours. That is a stakeholder to your project. Likewise, the youth programs, the women's programs, the health programs, all of these folks really are we normally see that, oh, that's a youth program, that has nothing to do with our project. No, this is a community health project, and they have everything to do with each other. So you want to make sure that you are involved with them and they're involved with you. We don't want to exist in silos anymore. That's not what PCORI really is likes to offer to the community. PCORI looks at these network connections in all directions and supports those network connections in all directions. So this is pretty. And I actually remember Dr. Padilla talking about that. You got to know who the naysayers and the yaysayers are within a mosque community, and you need to have them on your roster. So that you can keep them engaged, you can keep them satisfied. And again, you can refer the slides later on too. Now again, patients and caregivers with lived experiences, you have the whole list there. Now, again, I actually look at the total PCOR stakeholders in two different categories. Yes, I do have in mind that there are internal and external stakeholders to any project. However, I actually take the entire PCOR stakeholder population, and PCOR doesn't really, they actually do. They call it patient, researcher, and research partner, or patient partners. So they do have other terms related to stakeholders, and I would highly recommend you guys, each one of you, that when you are going through the PCOR Ambassador program or reviewing the documents on the PCOR's website, you make sure that you understand those terms, patient partners or the research partners, and understand the depth of those concepts, and adopt those concepts as your language, because it really helps a lot when we talk in those terms, because each term and each word with PCORI comes with a concept. So it is attached to a concept. And when we use the same words, you are literally bringing in the concept, and you are transferring the very concept in the other person's mind. So communication becomes very easy when you talk the same language. And Picori indeed has its own language, and we're going to talk about that in the communications plan tomorrow. So we see that pretty much all of these are different total stakeholders communities. Again, we are planning, we are managing, and we are monitoring the stakeholders. That's what the engagement is all about, right? So now, what exactly does the plan, manage, and monitor means in terms of action plans? And in terms of our project, actually. So the plan, project management says that plan means stakeholder engagement plan means you develop an approach to involve the stakeholders based on their needs, interest, expectations, and potential impact of the project success. By the way, these definitions are directly from project management. And I love it, the way it maps to our project. It's an amazing thing that actually lends credibility to the methodology itself, that it is so scalable that it doesn't matter what field you are in. You actually can take the methodology and tailor it to whichever discipline that you're running a project with. And that's the beauty of that details. That was a side note. Manage. So for managing, you actually connect with the stakeholders to meet their needs, address their issues, and foster appropriate stakeholder engagement. Who needs to be involved at what level? A purchaser is not going to be necessarily involved like a clinician or a hospital asset, right? So there is different levels of engagement there. And the social engine would actually allow us to manage the stakeholders and manage their needs through that. We have the assets map on the social engine. We got the stakeholders on there. We have an entire My Health, My Responsibility, a platform where we can communicate with each other. So we will see all of this engagements coming up in the next week or so, inshallah. So monitoring stakeholder relationship constantly. And the way we would do it is we would have the evaluation metrics, and these are basically reports that are being generated, and I'm automating these reports with the programmer because we are collecting all of the data online. So all of these reports will also be online. So I was actually hoping to have, you know how on the websites you have a grid going in that these are how many people you served. This is the number of people who are attached to your website, or these are the subscriber. We can have this evaluation metrics like that because that's our project actually have a very simple engagement metrics attached to it. Okay. So when you are doing an engagement plan, you're actually now, again, you identified, you analyze, and you develop appropriate engagement strategies. And our engagement strategy is the asset mapping, right? Now, how do we utilize peak or engagement principles to keep our stakeholders engaged, right? So again, we're actually planning this. You haven't really gotten to the execution part of it, right? So the conducting part of it, you're planning it, and you're planning your assets. So you're talking about reciprocal relationship, which we have many times this concept have come up. Both Dr. Padela, Dr. Johnson has clearly defined this concept to us, that reciprocal relationship means that equal partnership. It's not that you are in charge or they are in charge. This is an equal collaborative decision-making authority. For example, I come across with a community resource, and I think that this particular resource would be very valuable in supporting not all, but some of the community members that may need their physical therapy services, for example. And I would say that, I do see that. And this is a single person who runs their own shop, and they don't want to be really involved in the community because they think that, oh, they probably are going to ask me for free services. I don't know if I really want to be a part of this thing or not. I'm just the one person. I only have a one physical therapy assistant with me. I can only take so many patients. I really can't do this. This takes too much time. But you think that, this person, yes, they have the capacity and they may not be able to take like 10 patients, but they may be able to take 2 patients who already carry the health plan that they can bill for. So now you're going to talk to them and to say that, this is what we have to offer. Do you think would you like something, or what is it that we can help you? Or what is the need that you can work with them to support their need? They may have a need that they would like from you. So, in order to understand them better or develop that relationship better, you have to establish co-learning principles. So you learn from them and they learn from you. So this is how you would develop. Eventually, you will develop a reciprocal relationship. Once you start to learn about them, essentially they will learn about you. But you would have to take the first step, guys. I got to tell you this. Don't expect that they're going to come to you. You would have to identify that, wow, that's really good, and it can support these many. This is what it will support. How is it that? How can I get their buy-in? Now, this is what engagement is all about. And now you have to develop a relationship, but you start with the learning about them. And learning actually precedes, or transparency actually precedes learning. So you want to be transparent, you want to be honest, because you need to establish that trust. But transparency is literally the very first step. And transparency means literally being transparent. That's what it is. Dr. Patela mentioned earlier in his talk last time that if you don't show your face, how do I know you are transparent? That's one of the examples. That's definitely one of the examples that in order to learn, and I totally understand it. Even when I have a webinar going on, I actually have my the background or something like that, because I'm doing something other things. And even though if I'm sitting, I don't want people to be looking at me, because I'm comfortable. I can lay down or whatever I do. However, being transparent really mean you are responding, you are in the spirit of things, where the other person would look at you and be inspired. And that's the beauty. If you have a value that actually is a higher value, the other person will definitely follow you. And that's the principles of leadership, by the way. And that the beauty of these principles is that once you start following these principles, one thing will lead to another, and before you know it, give yourself 6 to 8 months. I'll tell you guys, this is all it takes. Give yourself 6 to 8 months following these principles. And if you don't turn out to be a leader, come back to me and tell me that I lied to you. That is one thing I do not hear from anybody. But 6 to 8 months, that's all it takes. And if you truly, that's how powerful these principles are. By the way, I just want to add one more thing, a side note. Speed of trust. I don't have that in the, but I will add this. Speed of Trust is actually a book that is written by Stephen Covey, who wrote 7 Habits of Highly Effective People. So he mentioned in the 7 Habits that he had a 9-year-old who actually needed to clean up the backyard in his absence, and he actually did not do that. So Stephen Covey walks us exactly how he made him accountable in his book for 7 Habits. It's a beautiful it's a beautiful story between a father and a son. But this is the same kid who actually took Stephen Covey's $30 million enterprise to $350 million enterprise, guys, in one shot, literally. And he wrote the book that is called Speed of Trust. It is a beautiful book. And what it talks about is that when you establish trust, it works like a blink of an eye. That's what it says. And in fact, I've seen it. I've seen it with myself. Once you have that transparency and honesty, trust comes like a snapshot. And the rest of the three steps are easy. So it all starts with transparency, and literally it ends up in the reciprocal relationships. So these particular values go backwards when you are practicing them. Okay. So I love it. I've done it. My coworkers have done it, and we have seen the results. And I would highly recommend all of you do too. And if you have any issues with that, any of these things do not make sense to you, come back, talk to us. You can talk to me. You can talk to Dr. Rebecca, and we will give you, and talk to any of the PCOR ambassadors. Actually, they'll tell you how these things work. Okay, stakeholder management. So now the stakeholder management is basically connecting with the stakeholders to meet their needs. For us, it would be easier because we have an online platform and we are going to be working with that. I just want to bring this figure out because PCOR actually has a framework of engagement. And I know Dr. Videla has gone through this once. And I would like to go with you a little bit more in detail or second time so that we refresh our memories and we know how to use this when we are managing stakeholders and managing their engagement. So these are the level of engagement. So this is where direct care, organizational. So this in direct care, you're dealing with patients. In organizational design and governance, you are actually dealing with team members. You are dealing with other executives of the organization. You are dealing with organization to organization level. At the policy making, you are dealing with the policymakers are way up there with CMS, with PCORI, with AHRQ, those kind of agencies, right? So there are three basic levels, not basic, but there are three levels of engagement. So at the direct care, this is where you can feel the patient-centeredness because you are that close to it. And whether you are a researcher or you are a person who's doing work in community health or in the community as a community health worker, and you are connecting the researchers with the community health, with the community members, you are involved in direct care. So the green top button here or the level here, this is what we are doing at our level. Organizations, this is basically comes in when you are dealing with organization to organization level. But in this particular scenario, in our scenario, we're basically, we can divide the engagement in consultation, involvement, and partnership and shared leadership. Consultation is basically informing. You're receiving a diagnosis, you're receiving or exchange of information. Now, this particular graphs or infographics is actually for a comparative effectiveness research project, maybe a clinical research project. But this is also applicable to our project. Why? Because it talks about the levels of engagement. You have a consultation level where you are basically you're talking to somebody who is, when you do an outreach and you talk to a patient or a caregiver, they want a basic information. Hey, where's that food pantry? Here's the information, and you gave them the information, what they required, and you're done. So that was an interaction at a consultation level. Nothing more, nothing less. Now, what is the involvement? I really, I need food pantry, but I need to have this particular kind of food pantry, and I need halal and zabiha meat because my doctor said I'm anemic and I need to have, proteins and especially meat. So can you tell me where I can find halal and zabiha meat? So you go back to and you say that, oh, wow, okay, let me figure out. Now you are involved in their cultural values. You are involved in literally satisfying that that stakeholders need, and therefore your involvement and their involvement is going to be a lot more than just basic consultation. And then you have partnered and shared leadership. So now you're telling them that, I found the food pantries. However, I couldn't find the Zabiya Halal. There are kosher food pantries. What about kosher meat? Can you have that? Do you need to have the halal and Zabiya? And they say that, yes, I really need to have halal and Zabiya. I can't do anything else. So now you're getting it more into in depth as to exactly what kinds of meat has to be halal and Zabiya. Does the egg has to be halal and Zabiya? And they're going to say, no, egg doesn't have to be halal and Zabiya. That's fine. How about fish? No, fish is okay too. Fish doesn't need to be halal and Zabiya. That's okay. Okay, so why don't I make sure that the kosher pantries can provide you fish and eggs so that at least some of your needs are met? See how the culturally sensitive information is now coming into picture, and now you are actually partnering with the other person. And though you don't have a halal and Zabiya food pantry, but the kosher food pantries are able to meet some of their needs. And now you are at a shared decision-making level with them. So this is how, and again, bioethics is a major component of this, and actually that plays a big role in the shared decision-making process, and that's why Dr. Padela's work becomes so important, and he becomes so important for the patient-centeredness, because it's essentially it is a big component. Bioethics is a big component of patient-centeredness. Okay, I want to basically finish up with a few last slides. So stakeholder engagement is now you are at the monitoring stage. So see how over here you managed their expectations, you managed their decisions, your co-learning took place, collaboration took place, and now you're moving on to monitoring. So now you want to make sure that their needs are met, they are engaged, and if their need comes back again, they can come back to you, or they can come back to the social engine, and this social engine is able to meet their needs. Then only we can support, or we can dent that health disparities. If this particular engine would not support itself, or does not becomes non-supportive at the end of the project, then we will not be able to see what our impact is in 2 years down the road. That impact would wash away. So it is very crucial for all of us to keep thinking that, yes, indeed, it's a project, but it's at the end of this project life cycle, it has to move into sustainability phase, where it will transform itself into a program to meet consecutive needs for the community members. We just can't abandon patients. That's a big no-no with worry-free community, and a personal big no-no. So in monitoring, you want to make sure that, there are 4 steps in monitoring. Keep a constant communication channel with the stakeholders to keep everyone on the same page. And alhamdulillah, the social engine actually provides that. You don't have to do it in a person, but a social engine is there to keep track of a lot of these things. We can run reports. We can see how many times a particular email address or a particular client came in. What kind of needs do they have? Are they high need stakeholders or low need stakeholders? We can actually look at all of these metrics. Foster a culture of trust and transparency to mitigate appropriate risks arising from misunderstanding and misinformation. So we are dealing with very sensitive information, guys, even though the food pantries that we put out, or another, for example, a health clinic that gives out injections, which is not, or vaccines that doesn't cater to Muslim patients, because some of these vaccines have porcine in it. Some of them, for example, heparin does, and some of the vaccines, that's a medication, but some of the vaccines can also be porcine based, and they don't care. They're telling, what, that's what we do. And so we simply put everybody on there, and we say that this is culturally appropriate. No, people are actually trusting you with a particular it just hit me that if IFENCA would provide us with their halal logo, just a thought. I don't think there is any such thing, but again, it is like that. So this information has to be culturally sensitive and culturally appropriate in order to support a particular community-based needs. So misunderstanding and misinformation would actually would be a detrimental to not only to this project but to the entire community. So then now delegating appropriate work and roles, and that's what we should also do. That there are stakeholders that have for example, the healthcare providers, the hospitals, the ACOs. There will be some work coming our way, so they need to have, or in order to maintain their transparency and their presence on our social engine, they need to have appropriate information that is connected with our links. So we need to make sure that they have assigned somebody on their end to support the work that goes in to manage the links that comes on to our social engine. So this is where we would be monitoring them and making sure that their information is correct and it's appropriate. Must create and manage, again, the stakeholder register. We've already you start with for monitoring. You actually start I actually do start with the initiation phase, and I start creating my documents when I first initiate the project. This way it becomes much easier to move on. Yeah, so the promise, right? So here's the power grid, power/interest grid for the stakeholder engagement. And you want to, so the stakeholders are actually, I find it very easy to work with this. So some of the stakeholders you need to keep satisfied, some of them you need to monitor with minimum effort, some of them you need to keep informed, and some of them you really need to manage closely, because the stakeholders that are high in power and high in interest, you got to manage them very closely. So for example, the mosque board members, the mosque imam, if they are directly involved. You may have some of the key members in the mosque community, which comes in at their power is high, their interest is high. You also may have low and low, monitor minimum effort. So the mosque president may not be as involved as the mosque secretary or mosque executive director is, because the president knows that the ED is taking care of something. Yeah, I don't need to be involved unless there is some kind of so I'll give you another quick cheat sheet. So these particular action items, again, this is a part comes from project management. These action items will help you keep all this or manage stakeholders in a very nice way. So on the stakeholder register, you actually do the ratings 1, 2, 3, 4. That's what I've done. And you say that this particular, for example, Dr. Rebecca Johnson, I have her in a high, in manage closely, or basically interest is highest, and so I need to keep her informed, actually, because her interest is very high, but she may not exert the power because she's dealing with a Muslim community and she lends the power to them. So but the power is low, but the interest is very high. So I need to make sure that I inform her, and the ways I can inform her is through newsletter, posters, flyers, website, program email addresses, and those kind of things. So need to make sure that the communications goes through. This is all goes into the communication plan. All of this goes into the communication plans. And sometimes you have to keep people on your speed dial when you are managing them closely, because you are managing the risk along with the communications. Okay. So in the nutshell, the PCORI recognizes that the following components are actually as major elements of the stakeholder engagement plan. So when we look at the PCORI's stakeholder engagement, and when we deploy the project management processes to it, we automatically take care of the PCORI's engagement elements, as well as we add that element of assurity with PCORI's methodology, right? So I'll just read through this. Stakeholder engagement must reflect a bi-directional flow of information, and that's what we are doing with the stakeholders are providing us with their information. So we ensure through social engine that there's a bi-directional flow of information. We have PCORI's engagement principles, the 4 or the 6 principles that we talked about, the continuum of engagement between consultation and collaborative and reciprocal relationship. We're doing everything in between, collaboration or shared leadership. And PCORI group must also include most of the categories of the PCORI stakeholders. So our group does include most of the PCORI's stakeholder categories with our list in the mosque. So we have taken care of the PCORI's stakeholder engagement components. And in a nutshell, you can be assured that you are going to be looking at a very engaged and dynamic group, inshallah. Rest assured, you can do your best, and you just then trust in the bigger forces that things are going to reciprocate in their best ways, inshallah. So this is it's all about relationships, stakeholder engagement, evaluation metrics. There are 10 components, and this is actually will be going in as metrics, and we would have sort of like a number. How you have an icon, and underneath the icon you would have the numbers as to however many people signed. And I would like to see this automated, actually. So inshallah, that's the whole idea. I think eventually we will have it automated, but it's going to take us about 6 to 8 weeks to get to the evaluation metrics development. So time to ponder, right? So PCORI, what is PCORI doing? PCORI is literally sitting at a large formal systems level, and it's trying to make a difference at the individual level. And therefore, it's coming to us with all of its methodologies, with all of its best practices, and saying that, this is how we can, these are the tools you can do to make a difference. So all of these, the policy, the community, the organization, program, it is actually all of these in between is actually has to represent in one way or the other to reflect what goes on at the grassroots level and with PCORI. So remember Dr. Johnson's the diagram with mainstream on one end and the grassroots is on the other end. All of this is right in between. So we are doing something very complicated. I totally agree. And I'm not going to say that this is something very easy. And you guys are embarking on something which people have decades of experience in. And this is your first project. So that is why you will feel the push. You will feel that this is a lot of material. And indeed, it is a lot of material, because that's what we are doing in a nutshell. And you are from one end to the other. So look through it, see. But what we are doing personally, the impact is at this level. But personally, what we are doing is very, very manageable. Where primarily you're done with your trainings. Saturday would be the last session, inshallah. The 3 things that you're left with is the outreach. I called it VirtReach. Actually, you'll find it tomorrow because it's a virtual outreach. I don't know if you guys like my term or not. Town hall and the conference. The conference is basically a very collaborative event, but the town hall, you would actually be doing that. So we're going to talk about this a little bit. I'm going to leave you guys with a thought here. So we have 6. I have sort of have this kind of arrangement in mind. So look through it. Give me your feedback. I haven't assigned anybody. I'm just looking at people, and all the question marks is where I need you guys to confirm me. By the way, the ISNS and the MAB, both of them, there should be question marks in there. I forgot to put it down, but I have 4 people in there because I don't know which communities you guys would like to support. Okay. So now I'm going to leave it all to Bev and Dr. Johnson here. Thank you so much, guys.
Okay, thank you so much, Fatima. That's great. So, should we just perhaps have a pause? And does anyone have any questions for Fatima, or just have a little, just breathe for 5? And there's a lot of information, as Fatima was saying. So please do ask some questions. I'll just count to 10, and if you have some questions, please do sort of post them or shout up now, and then I will introduce you to Bev, who is a good friend and a colleague, who we've worked together, and we shall talk about a little bit about what we've done together. But I think most importantly, I wanted Bev to sort of talk to you as a patient, a stakeholder, a PCORI patient stakeholder, and she will be able to say how she felt engaging right at the beginning, and then how she felt about being engaged with PCORI and doing projects going forward. But I'm just going to count to 10 and give us all a wee pause, and please do ask Fatima any questions or drop them in the chat.
Now I can't, since I'm actually have the presentation screen up, I can't look at chat. So if you guys have a question, just alert me and I'll switch my screen back to chat.
We will do, yeah.
Thank you.
Okay, so it looks like we at this particular moment you're all cogitating and reflecting. But keep doing that, and we'll come back and maybe give you a little bit more time for some questions at the end as well. So okay, so if we could have the next slide, Fatima. Thank you. So to just going forward, I'd like to introduce you to Bev, as I mentioned, who's a PCORI ambassador and a patient stakeholder. I'd like Bev to we're going to do sort of Q&A. So I shall ask some questions, and then I'd just like you to hear Bev explain the experience that she brought to the table way back. I can't remember, it was about 8 years ago, was it? It was a long time ago. And what she did before she got involved with PCORI, and then how she got involved and why, and how she's going to think back for you in terms of how she felt at that time. And then she did have an aha moment, and she's going to talk to you a little bit about when that came. But Bev and I have worked on 3 projects. I first met Beverly when she was as a member of the Pastors for PCOR, and then we worked together basically on the Happier project, which is a home care aid project. And we're continuing to work together. That we work together on the Dementia Friendly Library initiative, and we continue to be in touch and share knowledge. And what I find, Bev has a beautiful perspective and a lived experience, particularly in care and caregiving. And she brings all of that to the table. So I'll let Bev. Can you introduce yourself?
Hi, thank you for the glowing bio up front. Hello, everybody, and
oh, there.
Can you hear me?
Yes.
Okay.
Yeah.
Good. Before PCORI, I was and have always been fairly outspoken and an advocate for my own health. But my mother got sick and went into hospice, so I had to be an advocate for my mother. I married a man who I thought was love. Certainly, he was 12 years older than I, and he got sick. He was diagnosed with dementia, and so I took care of him for 13 years at home. And if you are a caregiver for anyone who has dementia or Alzheimer's, you know that it's the doctors and the the rehab and the hospital and just all kinds of things. You're just overwhelmed with things. And in my frustration, I decided to do some networking. I started looking at people and talking to my pastor and seeing where I needed to go. I had all of these things. I was angry. I was overwhelmed. I was just a crazy woman. I had retired from the corporate world. And I'm like, what is going on with my life? And so in my networking, I met people who kept introducing me to talk to other people, to talk to organizations, to be someone who would talk about it from the caregiver's point of view, or to be a part of the Alzheimer's Association and facilitate a caregiver support group. So I was doing it all. I was a caregiver and I was speaking and I was advocating. And someone introduced me to Pastors for PCOR. And in Pastors for PCOR, I sat there and I thought, all of these pieces of paper, all of this talking, and just like Fatima is talking to you, I sat there and looked at Rebecca and Regina and all these people talking. And I'm like, what did I get into? Who are these people and what are they talking about? I know nothing about research. I'm in the trenches here. Somebody needs to help me get a bullet for now, not the silver bullet for 20 years out. And once I went to that PCORI annual meeting, it was completely different. I had a researcher during the happy hour walk up to me and say, I can't understand why the diabetic patients don't understand that we have the better drug. And he's going on and he's talking about the metrics and the data and the blah. And I'm like, why are you saying all of that? If you want a patient to do it, is that how you would tell it to your mother? Your mother wouldn't understand what you're talking about. So why are you telling it to patients and expect them to understand it? And he kind of looked at me, he said, oh, well, yeah. And so that's when I found out that researchers live in a research world. They don't live down in the trenches. And when they get into the trenches is when they realize, oh my God, this is what I've been telling people. So that was my first involvement with PCORI. After that, it was like I drank the Kool-Aid. So I did merit review. Merit review means that you review the studies before they get funded to make sure that it has patient engagement, that it has all the things Fatima was talking about, that it has the patient's view, the stakeholders' view. Everybody is sitting at the table. So you're looking through the study to make sure that the researcher is doing what he's supposed to be doing to get the patient's view. Then I went into peer review. Well, that's when you do the peer review. You look at what has been paid for, what has been completed, and is it really ready to go out to the public? Some of them is like, you couldn't possibly be thinking that we're going to accept that. And some of them are very good, but at least you get a chance to look at it. Then I became an ambassador. And of course, as an ambassador, is networking. Is one of the best thing about being a PCORI ambassador is that you've got people that are all on the same page. They know exactly where you are. They know exactly what you're thinking. They may have a different opinion or they may have another way of doing it, but there's something about that network. It is amazing. Then I became a panelist. I applied to be on the patient engagement advisory panel. That was phenomenal. I absolutely love that because there I was really able to give my voice into PCORI for real. At least it felt more real to me. And so for me, being a part of PCORI is what led me to all of the other patient stakeholder projects that I'm participating in. I'm intelligent. I'm with a group out of Stanford. I'm doing things with Creaky Joints out of New York. So it leads you into different things, different arenas. But what it means is that you're giving your voice. And that's why I do it. And when people ask me to participate, the first thing I say to them, I am not window dressing. You either want my voice, you want my perspective, or you don't want me. And you have to know who you are, what you stand for, what your values are, and what you're bringing to the table. And that's what's important. So the lessons that I've learned, the highlight for me is making sure I stay true to what I believe. And some of those studies are not what I believe. If we want to go into, say, rare disease, I know nothing about rare disease. That's not my background. I am a patient because I'm 79 years old. I am on Medicare. I have been a family caregiver. I am a parent. I had a child that was diabetic at 10, a juvenile diabetic. I've had cancer. So I've got all kinds of experience, and my voice needs to be heard. I need to be at the table for all of those who say they are payers, the ones who pay the big part. But if you have any health insurance at all, you know that you pay a big part also. So having your voice at the table is the most important thing, and the most, I would say, the most overwhelming, but the most important and the most rewarding thing that you could do. Did I miss anything?
Thank you so much, Bev. The one thing I would like to add is that Bev is fearless. Bev is fearless, and that's one of the things I love. And so about sharing, I'm very generous with her experiences as well. So I will tell this story. Is that Bev was at the conference, was at a PCORI conference one year, and she disagreed, or she felt that a gap. There was a big gap. I can't remember what the topic was about. I think it's usually Medicare and Medicaid where you don't feel that's represented very well.
The insurers were on the platform.
It was the insurers, wasn't it?
Yeah.
Bev got up and made some very, very important points about what they were missing. And to be fair to PCORI, they came back to you, didn't they? They did. They heard you, and they came back to you. Mm-hmm.
Yeah, and that's the other thing about PCORI. I mean, I think there was only one meeting where I did not get up in a public arena and ask a question, because one of my gifts is being able to see the gaps.
Yes.
And I know where there is a gap, and I'm not afraid to phrase it so that they understand you're missing something. Mm-hmm. And every time at every meeting, they would say, "We're not ignoring you, but we don't have an answer."
Yes.
and that was always telling, is that they didn't have an answer, but someone would get back to me. And the last time they did not have an answer and someone got back to me, put me on the, it's called horizon scanning, so that if there are new products or new programs out, that they will send something to me where I will review it as, do you really think this will work for patients? How will this make a change in healthcare? So that they said, we need your voice on horizon scanning, so that before it goes out there, how do you think it will work? Are there disparities? Are there inequities? What do you see? And it takes time, and I have to write, but if I want to do it, it is worth it to me, so that someone behind me will at least, profit from from me giving my perspective, my voice, my lived experiences.
Yeah. Thank you so much. Mm-hmm. So actually, Fatima, would you mind sort of just moving the slides forward, because I want to make sure we haven't forgotten anything, and I wanted to show people how.
Sure.
Yeah, thank you. How Bev is. When you go to the website, because she's completed the ambassador sort of application and she's on there. You can see you can learn a little bit more about Bev's background, and so this is the way that PCORI has captured Bev's bio on the website. And as you can see, they asked Bev to talk about which research phases she'd been involved in. So she's involved in a collection of data, dissemination, prioritizing of research questions, and she's selected the health conditions so that people can see what she's interested in and what she would have experience to share about as well. So, and the next slide this is just a little sample of some of the roles. And so Bev beautifully told you about the merit reviewing, the PCORI peer reviewing, and the advisory panel. So that was merit review. That's of the grants, is it, Bev?
Yes, that's when they're asking for money.
Right.
When they've supposedly gone out and done all the research and then coming back to PCORI and say, we want money and this is what it looks like.
Okay. And what about the peer review?
Peer review is after they've completed the study and they're trying to get it out. They want people to look at it and see, does this make sense? Okay. If you have someone who somehow, we had one who wanted to do something with Spanish dancing in a neighborhood, and he'd never taken Spanish and he never danced. So it was just weird. So you get, people will ask to do weird things just to get money. But yeah.
Okay. Thank you. So that explains that. And then if you want to see a little bit more about these are the roles, and this is how Bev described her roles. So community liaison, engagement, working group member, advisory member. So these are different types of research and roles that Bev's been involved in. And then, yes, the final slide is, if we just go to the next one. So this is actually Bev presenting at PCORI about her engagement with a really big project, the Life Plan project, which is one of the sort of the types of projects that Dr. Bradella does. So we have our engagement in wards, and then we have these bigger scientific comparative effectiveness research projects. And so Bev, that's Bev presenting that. And I put this up because we started off by asking each other if research was a colour, what would it be? And I remembered that you told me it was blue, so I wanted to put that one up there as well. And do you want to say a little bit about the advisory panel on patient engagement? Because that was the one thing you picked out that you were very proud of.
I am very proud of it because you meet people from across the country from different backgrounds. Right. We had physicians, researchers, we had we had patients, we had some who were rare disease, and it didn't matter because you showed up in your jeans or your whatever you were wearing, and you talked about a specific area, how to engage the patient. And it was we were all on one accord that something was missing. And so that whole time was how to close the gap between what we know needs to be done and what is being done, as well as what we know needs to be done and what they think we need. And what we found is most people are making decisions based on what they think we need without asking us.
Yeah, no, that's a great way to conclude, I think, today's session, because I think Fatima did a fantastic overview of the project management and how to engage and the importance of reciprocal relationships, which is exactly what Bev is talking about here. It's just nobody's telling people what they need. It's hearing and listening and communicating and just being very aware of the people. Everybody's different and they all have different perspectives on things, and it's very valuable. That lived experience is very valuable. So I know we've come to the end of the session, but this was just how you would connect with the resources and the ambassadors. And as Fatima was saying, you can actually you could have a look on. There are many ambassadors, and you can sort of send a request to connect with an ambassador who works in an area that you're also interested in as well. And they really do encourage you to do that. And I think that's a good way of networking, as Bev was saying. And I think if we next slide, sorry, I can't spell ambassador. Okay, so that's yes. This is for tomorrow.
Tomorrow's session.
Mm-hmm.
Yes, so, thank you, Dr. Rebecca, for bringing up Sister Bev here. It's an amazing I can really feel what you would have felt possibly being at that advisory panel and the merit reviewer. And yeah, these are very exciting things, very exciting. I'm so, it's a pleasure, Beth, to hear you and meet you. And absolutely, it's, and thank you so much for sharing it. It was a great talk.
Well, thank
love
you.
to hear everything that you had to say.
Thank you. You're doing a great job. And the only thing I can say to everybody who is on the call, do not give up. You've got to persevere because you have no idea, none, what they're doing behind the scenes. They are making decisions without our voices. And if you're not in there, you won't know. So you've got to persevere. It's crazy. I know it's crazy. It's hard to stay sane during these times, but you've got to just hang in there.
Yes, I reiterate that. So, yes, so I'm sure Bev would, I mean, if anyone has some questions now, please, I'm sure Bev would be happy to sort of take some questions, or, you know, if you've got things later on that you'd like to, questions that come to mind, obviously you can connect with Bev either through the ambassador link, or I'm sure Fatima and myself as well.
And thank you, Beth, for sharing. Thank you so much. It was it was wonderful to hear from you. It was wonderful, very, very rewarding.
Can you see the chat, Bev?
Let me see if I want to see the chat.
Yeah.
Okay.
Bev, go on.
I can see the chat, yes.
Excellent, because I yeah. Very good.
Anybody, any comment or anything?
Do I find the researchers resistant? I did not find researchers resistant. It might be because of my personality, but so even if they were resistant, I'm persistent. So, but what I have found is that in the reviews that I do, I always ask if there was anything that I missed, because I don't want to, be way off course. And I have found people saying, we really appreciate your honesty. We really appreciate hearing someone who is telling us exactly what is happening and what it means, and asking questions that we hadn't thought of. And it's because a lot of the researchers do not think about it, and I'm sure you're saying the same thing. How is it they can't think about it if they're human and they have families? How do they miss that? But it is interesting that they stand back and do the work, but they don't necessarily see themselves in the trenches unless something happens. But resistant, no. The only time, let me say, there is one time I was at a merit review and there were more researchers than patients. And they have a tendency to click the minute. I mean, they get together and all of a sudden it's like gum, chewing gum. When you put one piece of gum with another one, it all kind of gets in this one big glob. And it was like a big glob of researchers. And I'm like, why? So that was the only time that it was not necessarily resistant, but I saw what I was working with.
Okay. Interesting.
By the way, are there researchers on this line besides Rebecca? Rebecca knows me. I don't want to insult the rest of you. Rebecca knows me. I talk to her all the time. So if there are researchers on this line, please forgive me. I do love you.
You're a patient researcher. You have that privilege, actually.
Yeah, and I think that's a really good point, Fatima, actually, because Bev is a patient researcher.
Yeah.
You know, it's this idea that, I mean, it's nice to have. I mean, I know at the PCORI conference they talked about it's all very well for fancy degrees, and there is actually a point about that. You know, there is a sort of. It's important. The lived experience cannot so often get lost. You know, once people have come up with a policy or they've come up with a new design, and
Yeah.
that's just when it starts, really, because that's when
Yeah.
people are beginning to use
absolutely.
it.
And then it really quickly dissolves itself too. Absolutely. And so keeping that in. Yeah, absolutely. Because that's where really the 80% of the factors that we do see are non-clinical factors that are impacting health disparities. Okay, thank you guys. If you do have any questions, we'll wait another 30 seconds. If not, then we will see you tomorrow at 5 o'clock for the communications plan. Thank you, guys, and thank you, Dr. Rebecca, once again. For bringing Bev, and thank you, Bev, for joining us and being a part of our wonderful training program. It's really it is coming out nice. Dr. Rebecca has literally brought it together.
Yeah, she's my buddy, so I know she's working hard.
You got a really good friend there. I got to join you guys a circle now.
That's right. Well, that's the beauty. It's a networking.
Absolutely.
Yeah.
Now, is Bev in Indiana, or is she out here in Chicagoland area?
No, I'm in Indiana. I moved to Indiana 2 years ago.
Oh, okay. Okay.
Yeah, I moved here and thinking that I was going to be pretty, still, and I'm busier than ever now. It's amazing.
Yes.
That's good. Very good.
You grew up in Chicago, didn't you, Bev? Is that right?
No, I was born in Kansas City, raised in Milwaukee, and moved to Chicago with my first husband.
Oh, okay.
Wow.
Yeah, and now I'm in Indianapolis, and let me tell you, it is not the same. Oh, it is.
Yeah.
And I'm in a senior community, so that also makes a difference. It's a new journey for me, but it means that I have new experiences to share.
Yes.
Oh, absolutely. And